Hello, my name is Professor Wendy Graham from Impact and the Soapbox Collaborative at the University of Aberdeen. For the last 4 weeks, we've had the pleasure of being joined by visitors from the Gambia and from Nigeria who have joined us for the first of a fellowship programme that we've been hosting at the University of Aberdeen. The fellows have joined us to learn more about infection prevention from NHS Grampian and from our work here at the University of Aberdeen, and are going back tomorrow. So this is the last opportunity, as it were, to interview both of them and to hear about their perspectives, the lessons they've learnt, what they'll be taking back. And this is part of a continuing relationship that we hope to maintain with our partners. So there are two partners. One is Dr. Randawa from Zaria in northern Nigeria and Keba Mane from the Gambia. And I'd like to start off by interviewing and hearing Dr. Randawa's perspectives on his time with us for the last 4 weeks. So Dr. Randawa, it's a great pleasure to have you with us, and obviously having survived 4 weeks in Scotland, my first question has to be, how was the weather?
Well, the weather is really quite different from where I came from. I found it quite cold initially, but luckily enough, over these 4 weeks, it has come down to the level that I found it comfortable.
Very good. We do like people to acclimatise. So 4 weeks is quite a short time, but you've coped very well. Given in Scotland we have 4 seasons in a day, and you'll be going back to some lovely warmth in Zaria now.
I think I've experienced all the 4.
So we're very lucky to have Dr. Randawa. Dr. Randawa is the head of the Department of Obstetrics and Gynecology at Ahmadu Bello University Teaching Hospital in Zaria. This is a very famous hospital, has been practising best practice in obstetrics and gynecology for many years. And the University of Aberdeen has had a relationship with Ahmadu Bello for quite a few years now. But we particularly are welcoming Dr. Randawa, who will go back and share some lessons from his experience with NHS Grampian. So Dr. Randawa, thinking to these 4 weeks that you've spent with us, partly in the university and partly with NHS Grampian, to start with, so the listeners can get some sense, could you just tell us a little bit about the sorts of challenges that you face as in the teaching hospital in Zaria?
Well, Ahmadu Bello University Teaching Hospital is a tertiary care health facility. We try to offer the best care that we can in a specialist capacity. However, we have our major challenges that we cope with and try to overcome on a daily basis. And this ranges from infrastructural faults, supply of basic equipment and consumables, and also availability of guidelines for standard of practice by healthcare providers and their adherence to this staff that provides care to the patients. I remember I had to get a picture from the web that was posted by a patient online and trying to depict the deplorable condition of my teaching hospital. But I can assure you we are trying our best every now and then to see how we can get those faults repaired. Again, simple basic supply for infection prevention are major challenges, perhaps because of the complex administrative process that we have that may necessitate crossing a lot of hurdles to get things done. And I think this is an area that we need to look inward to see how we can simplify how we administratively run the hospital so that we can make things much easier and available as much as possible. The availability of guidelines is another issue. The federal government, in collaboration with a lot of non-governmental organizations like DFID, like USAID, putting heads together to produce so many guidelines. But unfortunately, for one reason or the other, these guidelines are not routinely available at the service point, and where they're available, they are not routinely adhered to. Of course, that partly has to do with the availability of what is required to adhere to these basic guidelines, especially that has to do with infection prevention and control. So it's an area that is a really major challenge. We are looking forward to see how we can overcome such challenges, especially with assistance from major institutions that we are collaborating with.
Okay, thank you. So, I mean, this area of improving maternal newborn health is a global need. I mean, here close to home, back in Aberdeen, there's always efforts to improve M&H. And it's been a great opportunity for us to hear about your challenges as well. So reflecting back on these 4 weeks, and I know when we've spoken before, you were delighted with the opportunities you've had to see the different wards, to learn about infection prevention and the challenges that we still face back here. Can you just tell me a little bit about the things that are very striking from your 4 weeks experience here in Aberdeen?
Having gone around, especially the Royal Infirmary Hospital, the Peterhead maternity unit, and also the community health village here in Aberdeen, what struck me most was the patient safety strategies that have been employed in the care of patients, with emphasis on patient-centered care. I realized in the wards and also at both Peterhead and the community health village, the improvement tree that I see being displayed, where patients try to say their minds of how they were cared for and what area they think needed to be improved, is being so displayed, and the improvement plan that the healthcare units have, where they tell the patient, this is what you said and this is what we are doing. It's wonderful. It's really fascinating. And all these are being done with emphasis on using what is basic on the ground. The infection prevention and control team and how they handle this in the wards, especially the hurdles that are being handled by the in charges of the various wards every day on routine basis. Simple rituals like hand washing are being quite strictly adhered to, and the way I see the adherence to guidelines being displayed such that any reduction below a minimum acceptable level, which is 95%, is really wonderful. And I realize that no patient wants to be identified as not adhering to standards of practice, especially when it has to do with infection prevention control. At the same time, the environmental hygiene that I see, the cleanliness of the environment surrounding the patients and the care providers, is something that is unique. Honestly, I have not seen a clean hospital in my life like the way I see it here. And it's something that really is one of my aspirations. I have not seen bigger equipment when staff are talking about patient-centered care and quality improvement in patients' care. I haven't seen MRI. I have not seen a complex ultrasound machine. All I saw was simple cardiotocograph, a single bed labor wardroom, so clean, with all that is required to conduct a normal delivery. And of course, a very standard operating theater that is so clean with all that is required within the shortest possible means to deliver a baby in the best hands that I see around this hospital. What also struck me is the maintenance of standard of care and practice using the same guidelines and standard from a big tertiary hospital like Royal Infirmary Hospital down to a basic maternity unit like the Peterhead and also the Community Village Health Center. Although I realize that the kind of services being provided at these 3 service points may differ, but the same standard of practice are being adhered to. Peterhead maternity unit is as clean and using the basic equipment that are the same that I see in the tertiary level of at Royal Infirmary Hospital. In fact, I was sharing this with a friend and who told me that at one time, the Prime Minister of UK fell sick on the road and he was managed at a community village health center. That was really fascinating. That means you are so sure of your standard of practice anywhere, and the patients that come to all these service points are receiving the same kind of quality of care. This is really something that strikes me.
Mm. And I think that issue you've hinted at is that for some aspects of care to save mothers and babies' lives in developing countries, it is quite basic. Infection prevention, basic hand washing, attention to hygiene. And although at times for some complications you do need something more sophisticated, as you rightly say, Dr. Randawa, we mustn't forget there are some first-line attack that we can have in terms of preventing illnesses and infections, and as you know, that's what the focus of Soapbox and Impact is trying to do. So having seen those observations and witnessed what you're just saying in a variety of different settings in NHS Grampian, what are your aspirations when you go back, as of tomorrow, when you go back to ABU? What are the sorts of things you're hoping to share back there and achieve?
I was really inspired by many things that I have seen, and that really determined my aspirations to, as a matter of priority, see what I can do to get all hands on deck to reduce hospital-acquired infections to the barest minimum. Everybody is involved in this because infections can come from the environment, they can come from the care providers, and of course in my country, sepsis is one of the major killers of women simply because they are pregnant or after delivery. It's a major cause of maternal mortality. Therefore, combating infections is a major priority that I aspire to go back with all the protocols that I have seen being adhered to here to see how I can do that in my facility. Again, going through the maternity and labor ward, I was really fascinated by the cleanliness of the environment. And it does not only does it add to the patient satisfaction, but reducing the risk of infection. I am not really aspiring to put all the gadgets that I have seen in that labor ward, but I am determined to see how I can improve the cleanliness of our labor wards to the level that I have seen. Again, simple hand washing has been an issue for more than a century. And I remember historically, the first person that realized that staff and environment are a major cause of infection that leads to maternal mortality is from this hospital, University of Aberdeen. And I'm not surprised that this hospital has given importance to hand hygiene, and it's something that I am taking back to my center. In every room, and at every level of where the healthcare provider is supposed to wash his hand, I have seen a display of simple guidelines of what should be done and what is required is also available. So improving hand hygiene by healthcare providers is something that I'm aspiring to really improve in my healthcare facility. We have our major challenges of sometimes basic running water or availability of antiseptics, but it's not unsurmountable. I also realized that in this unit that I have gone around, there are practices that have been institutionalized. Every morning there's a huddle that takes place for simple 10 minutes to look and discuss of the common challenges and problems that can quickly be taken care of so that the provider's practice will be satisfying, the quality of care to these patients will also be improved. And it's something that I'm really taking back home.
Right. Well, and thank you for mentioning Alexander Gordon, who's this famous general practitioner in 1795, who was the first person to point out that poor hygiene at delivery spread puerperal sepsis. And here we are working together trying to prevent that cause of death for mothers and sepsis in babies almost centuries later. But it's interesting how some very basic actions can be taken. So it's been very important for us. I mean, as always with these sorts of visits, one learns a lot, and it's been a great privilege working alongside you and an opportunity to learn about the challenges you face and obviously to follow up in country afterwards. But it's very important also for our visitors to also share your perspectives on what we should do differently. And sometimes when you're very close to service provision, you can't spot the obvious, you can't spot those things that you're doing well about, or indeed the things that you should value. So we'd very much welcome your thoughts about advice to the NHS.
Yes, in these last 4 weeks, having understood the healthcare delivery system, I realized that we have some similarities but a lot of differences. Some of them that I see being used here. At a time in my country, there are some state government that were trying to do the same, but they ran into problems. And this is the issue of free care for all patients, because this is what I have seen here. All patients get care free. Although the workers say they are being taxed a lot, I think up to 40%, but it's not everybody that is on the government payroll. A lot of people are getting care free, and I wonder how sustainable that will be, because another advice I have is that please, this patient-centered care that the hospital is practicing is wonderful, most important. From my experience from the virtual conference, it looks like this is the trend, but you people have gone far, and I think you should maintain that. I have seen quite a few complaints from patients, but these are minor complaints which eventually get solved. Therefore, patient-centered care is an achievement, and I think it should continue. Another advice I have for this facility is they need to see how they can engage the medical staff in all their programs. As simple as infection prevention and control is, I have seen that there are some challenges in getting them on board. But I don't think this is a major challenge if they are carried from the beginning. There are ways and manners that professionals behave, and I think we have social scientists that can look into that. And I really feel you should bring in the medical staff to be as much as possible be involved in whatever major change you want to bring into the healthcare delivery. We are a third world country, Nigeria, Gambia, and other African countries. We need the assistance of NHS Grampian to make progress. You people are centuries ahead of us. We have our major challenges, and I would appreciate if there is more exchange of visits, of course, more support for my kind and other staff from my facility and from the country at large to be coming for this kind of program. This will make us see where best practices are being, of course, done, and we can then see how we can also follow suit.
So on that note, I'd just like to sort of thank you so much for the time you've come. I can imagine you have a very busy department. It's very difficult to have that leave to come and be with us. We've learnt a lot, and I hope this is the beginning of a continuing relationship as we strive together to try and reduce infections related to the delivery. So thank you very much indeed, Dr. Randawa.
Thank you, Prof.
Thank you.